It has an excellent circulation, an excellent blood supply, so it really can kind of cover up for some things because it can really heal itself super well. Also, we and I give you antibiotics during surgery and antibiotics after surgery. But nonetheless, you're coming in that first visit, I'm checking for infection. We want to make sure that we don't have any of the following things. We don't want any bright red areas. We don't want any unusual warmth of an area. We don't want anyone to, hopefully don't have worsening pain of an area, especially isolated versus other areas. We want to make sure that the swelling is fairly symmetric. Swelling won't be completely even from one side to side, but we want to make sure there's not one side that is immensely swollen. And of course, we want to look for drainage. We want to look for any type of drainage, whether it's clear, whether it's yellow, whether it's green, and that just indicates that your immune system is in there trying to fight, and there actually is some type of bacterial infection, and we need to intervene. And if I see that early, it can be minimized because it probably hasn't gotten out of control and is very isolated. Certainly nothing like this. This is something as a picture, not of my client, but just a picture I have. That's something that it is isolated to an area, but it's a little bit more extreme, and I don't expect that at 2 days. I would expect 1/10 of this area if I had a problem, and I could, jump in at 2 days and minimize it and prevent it from looking like this if we didn't see you soon. So, again, what we look for: bright red areas, unusual warmth, of course, worsening pain, any asymmetric or pronounced swelling, and a certainly drainage. And you can have some other things. You don't really feel great. I mean, worse than you anticipated. You're not eating, you're not drinking, you feel like you have a temperature. You may even have night sweats. So, again, that's worst case scenario. But again, seeing you in the first 2 days, even if you have a smoldering infection, we can nip that in the bud.